Okay, so today we're going to deep dive into some really important, like foundational nursing concepts,
Yeah,
right?
absolutely.
It's going to be like your, shortcut guide through all this essential info that you, as our learner, are going to be working with as you're, moving through your nurse's education.
Right.
We're going to be pulling key insights from your provided review materials
Yep.
and focusing on communication, nurse-client-family relationships, self-concept, sexuality, spirituality,
Okay.
and then getting into like the physiology of fluid and electrolyte balance, balance, perfusion, oxygenation, and then genitourinary function.
Wow, that's a lot.
It is a lot, yeah, but we're going to break it down.
Yeah, we're gonna make it digestible.
Exactly. We want you to be able to not just like define these things, but actually apply this knowledge, when you're working with real patients in different scenarios.
Exactly. Application is key.
Yeah. So let's get started.
Okay, let's dive in.
So first up, communication. Something that like honestly underlies everything we do in healthcare.
Oh, for sure.
Your materials talk about, different types of communication, like therapeutic and non-therapeutic, and then social communication, and something called motivational interviewing.
Right.
Can we start with like, what's the big idea behind therapeutic communication?
Okay, so therapeutic communication is really fascinating because it's all about, intentionally creating a space for healing and growth for our patients. It takes place within that professional helping relationship.
Right.
And it really focuses on their personal development.
Okay.
So things like their sense of self, how they connect with other people,
Okay.
how they can achieve their health goals.
Gotcha. So it's not just like casual conversation. It's very purposeful.
Exactly. It has a specific direction.
So what are some like qualities in a nurse that really make therapeutic communication work well?
To truly understand and help your patients grow, you first have to understand yourself. Self-awareness is so important. Recognizing your own biases, how you react to things.
Okay.
You also need that genuine motivation to want to help people.
Right.
And empathy, being able to put yourself in your patient's shoes,
Yes.
understand their feelings is absolutely crucial.
For sure.
And having good social skills, being able to connect with people easily,
Yeah.
helps you build that initial connection and trust so that you can have those deeper conversations.
Makes sense. It's about being present and understanding.
Exactly.
Now, on the other side, we have non-therapeutic communication, which your notes called blocking.
Right.
That doesn't sound good.
Yeah, blocking is basically anything that you do or say that kind of gets in the way of building a good relationship with your patient, and it can even make things worse.
Oh, wow.
These are responses that tend to shut down the conversation or, ignore what the patient's truly feeling.
Oh, so almost like dismissing their concerns.
Exactly, or, shifting the focus away from them and their needs.
Okay, I see. Can you give us like a specific example of how, even a comment that seems innocent
Oh, yeah.
could actually be blocking communication?
Absolutely. So imagine a patient is expressing, fear or worry about a new diagnosis.
Okay.
Something serious, and your response is like, oh, don't worry, everything will be fine.
Yeah.
Now, even though you might have good intentions,
Yeah.
that kind of statement dismisses their very real fears and anxieties.
Oh, for sure.
And it really stops them from feeling heard
Right.
and, being able to explore those emotions more fully.
Okay.
Another example would be like changing the subject abruptly.
Oh, yeah.
When a patient starts talking about something difficult or emotional.
Right. It's about validating their experience.
Exactly.
Not minimizing it.
For sure.
And then we have social communication, which kind of feels like that everyday chit-chat.
Right.
How does that fit into nursing?
So social communication is really important for those, initial moments when you first meet a patient.
Okay.
It's a way for you to get to know each other on a human level,
Yeah.
build a bit of comfort rapport.
Yeah.
You might make small talk about the weather or ask about their family, just to make them feel at ease.
Right.
Before you start asking about, their medical history or doing any kind of assessment.
Okay, so it's like breaking the ice.
Exactly.
Building that initial connection.
Exactly.
Okay. And then we have motivational interviewing, which sounds very specific. It seems like it's focused of helping patients make positive changes.
Exactly. Motivational interviewing is all about encouraging patients to share their thoughts and feelings.
Okay.
To, explore their own reasons for wanting to change.
Gotcha.
It uses a lot of open-ended questions,
Okay.
reflective listening, and it really empowers the patient to find their own solutions rather than, just telling them what to do.
That's powerful.
Yeah, it is.
Okay, so let's move on to like the actual mechanics of communication. So verbal and nonverbal.
Okay.
Obviously, verbal is about the words we use,
Right.
but there's got to be more to it than just, dictionary
Oh,
definitions.
absolutely. So much more.
Okay.
Verbal communication includes everything from the words you speak to what you write in a patient's chart.
Okay.
But the way you use those words is just as critical.
Oh, really?
Yeah, for instance, your vocabulary.
Okay.
Are you using terms that the patient understands?
Right.
You want to consider the denotative meaning of a word,
Uh-huh.
the literal definition, versus the connotative meaning,
Yeah.
which is the emotional baggage a word might carry.
Interesting.
Your pacing, how quickly or slowly you speak,
Yeah.
your intonation, the tone and inflection of your voice.
Mm,
These can completely change how your message is received.
for sure.
Clarity and brevity are super important
Okay.
to make sure the patient understands you.
Right.
And the timing and relevance of your communication are crucial for it to be effective in that specific moment.
Gotcha. So it's not just about what you say, it's about how you say it.
Exactly.
And making sure it fits the situation.
Yes,
Okay, nonverbal communication, now that's a whole other beast.
it is.
It's all those unspoken cues, right?
Precisely nonverbal communication involves all 5 senses
Wow.
and all those unspoken and unwritten messages that we send.
Hmm.
Your voice tone, even when you're not saying actual words, conveys a lot about your emotions and attitude.
Right.
Eye contact can signal engagement and respect.
Uh-huh.
But remember that cultural norms vary a lot.
Yes, definitely.
Your body positioning, how you're standing or sitting,
Okay.
your posture, even your personal appearance,
Interesting.
all send messages about professionalism and approachability.
I see.
Gestures, the sounds you make, like sighs or groans,
Yeah.
your posture and gait, your facial expressions.
It's like a whole language.
It really is.
We touched on this earlier, but, a patient's sociocultural background can really impact
Oh, absolutely.
how they're interpreting all these nonverbal cues.
Huge impact.
So important for nurses to remember.
Yeah, it's paramount. A gesture that, means understanding in one culture
Right.
might be considered rude in another culture.
Wow.
Avoiding eye contact might be a sign of respect in some cultures,
Yeah.
but seen as disengagement in others.
Yeah.
So being aware and respectful of these differences is fundamental to culturally competent care.
Absolutely. Now, your notes detail these zones of personal space, which seem like really
Yeah,
practical ways to think about how we interact with patients physically.
it is very practical.
Yeah.
Understanding these zones helps you approach and touch patients in a way that respects their comfort and their boundaries.
Okay.
So first we have intimate distance, which is 0 to about 18 inches.
Okay.
This is for people we're very close to.
Right.
It includes things like holding an infant, doing a physical assessment,
Yeah.
assisting with personal hygiene like bathing or dressing.
So those times when close contact is necessary.
Exactly.
Okay, what's next?
Next we have personal distance, which ranges from about 18 to 40 inches.
Okay.
This is a good distance for sitting at a patient's bedside to take their history
Uh-huh.
or, providing one-on-one teaching.
Okay.
It allows for that personal connection,
Yeah,
but still gives them some space.
right. Makes sense for those more direct interactions.
Exactly.
What about social distance?
Social distance is about 40, 12 feet.
Okay.
This is for more formal interactions
Uh-huh.
or when you're talking to a group of people,
Right.
like giving directions to a visitor in the hallway,
Yep.
asking a family member a question from the doorway,
Okay.
giving a report to a group of colleagues,
Gotcha.
things like that.
And then we have public distance, which sounds like it's for larger gatherings.
That's right. Public distance is anything beyond 12 feet,
Okay.
like giving a lecture to a big group of students or speaking at a community event.
Right.
There's a much greater separation between you and the audience.
Yeah, I can visualize those distances now.
Good.
Now, you also mentioned special zones of touch, and this feels particularly relevant
Oh, yes.
because as nurses, we often need to touch patients.
It's essential to be mindful of these zones and always prioritize the patient's comfort and consent. So the social zone includes areas like the hands, arms, shoulders, and back.
Okay.
It's generally okay to touch these areas without needing to ask permission,
Right.
like, a comforting pat on the shoulder or shaking someone's hand.
Yeah, those feel less invasive.
Exactly.
What about the consent zone?
The consent zone includes the mouth, wrist, and feet.
Okay.
Touching these areas usually requires you to ask for permission
Right.
before you do anything.
Yeah, like checking a pulse or doing foot care.
Precisely.
You're moving into more personal space.
Exactly. And then we have the vulnerable zone.
Uh-huh. That sounds like extra sensitivity is needed.
Yes, the vulnerable zone includes the face, neck, and front of body.
Okay.
Touch in these areas can feel very personal.
Right.
So you need to be extra careful, communicate clearly about what you're doing and why.
Got you. And finally, the intimate zone.
Yes, the intimate zone includes the genitalia and rectum.
Okay.
Any touch in these areas requires not only explicit permission,
Right.
but a very clear clinical justification, sensitivity to the patient's discomfort and vulnerability.
Yeah.
And meticulous attention to privacy and dignity.
Understanding these touch zones is so important.
It is.
Just to always be aware of a patient's boundaries.
Yes.
Now, let's zoom out a little and talk about the broader context of communication.
Okay.
And your notes mention this word meta-communication.
Right.
What exactly is that?
So meta-communication is essentially all the factors that influence how a message is understood.
Okay.
It's not just about the words themselves, but the context,
Right.
the relationship between the people communicating,
Yeah.
even their individual internal states at that moment.
Hmm.
Paying attention to both the verbal and nonverbal cues
Uh-huh.
really allows you to get a deeper understanding of what the patient is trying to say,
Okay.
including their underlying feelings and concerns.
That's insightful. And you break this down into different types of context, starting with what you call the psychophysiological context.
Right.
What does that involve?
The psychophysiological context refers to all the internal factors
Okay.
that can influence how someone communicates.
Hmm.
So for the patient, this could be their physiological state.
Okay.
Are they in pain? Are they tired? Are they hungry?
Right.
Their emotional state, are they anxious? Are they scared? Are they hopeful?
Mm-hmm.
Their developmental stage. A child communicates very differently than an adult.
Yeah, for sure.
Any unmet needs, like, feeling unsafe or alone,
Right.
their attitudes, values, and beliefs,
Okay.
including how they view their illness,
Hmm.
their personality, their perceptions,
Mm-hmm.
and finally their self-concept and self-esteem.
It's a lot to consider.
It is. It's a lot going on inside.
Yeah. For example, how might a patient's pain level, like if they're in a lot of pain,
Yes.
how could that impact their communication?
If a patient is in severe pain, they're not going to be focused on anything else.
Right.
Their main goal is going to be getting that pain relief.
Mm-hmm.
They might be less patient. They might have trouble concentrating on what you're saying.
Yeah.
Their nonverbal cues might show their discomfort,
Right.
grimacing or restlessness.
For sure.
As a nurse, recognizing this, helps you adjust your approach.
Okay.
You might need to keep your questions brief,
Mm-hmm.
focus on addressing their pain first,
Yeah.
and then maybe wait until they're more comfortable to have a longer conversation.
Right. Prioritize the pain relief.
Exactly.
Then we have the relational context. What's that all about?
So the relational context is about the nature of the connection between you and the patient.
Okay.
Is it a formal professional relationship or is it more casual?
Yeah.
What's the level of trust? How much caring are you communicating?
Right.
What about self-disclosure from both sides? Do you have a shared history with this patient?
Interesting.
And what's the balance of power like in the relationship?
Hmm.
All of these things affect how you communicate and how your message is received.
For sure. So how is a nurse-patient relationship different from, say,
Okay.
a conversation I'd have with a friend?
Well, in a friendship, the relationship is more equal.
Yeah.
You both share and listen, and the focus is on mutual enjoyment or support.
Yeah.
But in the nurse-patient relationship, the focus is always on the patient
Okay.
and their well-being.
Right.
There's a power dynamic there because you as the nurse have the medical knowledge,
Yeah.
and the patient is often in a vulnerable position,
Mm-hmm.
seeking your help.
Okay.
Professional boundaries are so important
For sure.
to make sure the focus stays on their care.
Gotcha.
Trust is vital, but it's professional trust
Yeah.
based on competence and ethical practice.
Right. It's a different kind of trust.
Exactly.
A really important distinction.
It is.
Okay. What about the situational context?
Okay, so the situational context is simply the reason why you and the patient are communicating.
Okay.
Are you doing an assessment? Are you providing education?
Right.
Are you discussing discharge plans?
Yeah.
Or are you responding to an urgent need?
Okay.
The purpose of the interaction really influences the content, the tone, the flow of the conversation.
Yeah. Can you give us an example of how, that situational context might change
Sure.
how you're communicating?
Absolutely. So think about a patient who's just been admitted to the ER in severe pain.
Okay.
Your communication is going to be very focused and direct.
Right.
You need to get essential information quickly and provide immediate intervention.
Yeah.
That's very different from a conversation you might have with that same patient a few days later
Uh-huh.
when they're getting ready to go home.
Okay.
Now you're focused on teaching them about home care,
Right.
answering their questions, making sure they feel prepared and confident
Yeah.
to manage their health.
Gotcha. So the urgency and the goals of that moment really dictate
Absolutely.
the style of communication.
For sure.
Makes sense. Okay, what about the environmental context?
The environmental context is all about the physical setting,
Okay.
where the communication takes place.
Hmm.
So things like privacy, noise level,
Yeah.
temperature, comfort, safety, distractions.
Mm-hmm.
These can all impact how effectively you can communicate.
Yeah. That makes sense. Are there things that nurses can do
Oh,
to
absolutely.
optimize the environment?
Lots of things. So whenever possible, try to find a private space to talk.
Okay.
Minimize background noise by turning off the TV or finding a quieter area.
Right.
Make sure the patient is physically comfortable.
Uh-huh.
Offer them a blanket, adjust the lighting,
Yeah.
and try to minimize distractions by really focusing on the patient.
Okay.
Simple things like pulling the curtain around the bed
Yeah.
can make a big difference.
Those are great practical tips.
Good.
And finally, we have the cultural context.
Yes.
We talked about this with nonverbal cues, but it goes beyond that, right?
It does. It's much broader.
Okay.
The cultural context includes the patient's education level,
Mm-hmm.
their language,
Mm-hmm.
their cultural customs and beliefs,
Right.
their expectations of healthcare providers.
Okay.
Being culturally sensitive means being aware of and respecting these differences
Yeah.
to provide care that's tailored to the individual.
Absolutely. So we've seen that communication is so much more
Yeah.
than just exchanging words.
Not much more.
Now, let's connect this back to like the core of nursing, the nursing process.
Okay.
How are communication skills important at each step?
Communication skills are essential for every single step
Okay.
of the nursing process.
Let's start with assessment.
All right, so assessment is all about gathering information about your patient,
Uh-huh.
right? So many of this involves talking to the patient,
Okay.
asking them about their history, their symptoms,
Yeah.
how they're feeling,
Right.
using open-ended questions, active listening.
Uh-huh.
But it's also about observing those nonverbal cues,
Yes.
body language, facial expressions, tone of voice.
Okay.
You're also using your senses during the physical exam
Right.
and reviewing, their medical records.
Sure.
All of this requires strong communication skills.
Gotcha. So can you give me an example of like a specific assessment question a nurse might ask?
Sure.
And what kind of nonverbal cues they might be looking for?
Okay, so a nurse might ask something like, "Can you tell me more about what makes your pain worse?"
Okay.
And while the patient's answering, they'd be observing their nonverbal cues.
Uh-huh.
Are they wincing? Are they guarding the painful area?
Right.
Are they making eye contact or are they withdrawn?
Okay.
Is their voice strained?
Yeah.
These nonverbal cues can give you valuable information
Right.
that adds to what they're saying verbally.
Yeah, it paints a more complete picture.
Exactly.
You have to put those pieces together.
Yes.
Okay, what about nursing diagnosis? How does communication play a role there?
So in nursing diagnosis, you're analyzing all the data you gathered
Okay.
during the assessment.
Uh-huh.
This involves critical thinking on your part.
Yeah.
But you also need to validate your understanding with the patient.
Right.
You might say something like, "It sounds like you've been feeling very tired and short of breath,
Okay.
and this is making it hard for you to do your usual activities." Is that correct?
Yeah.
This gives them a chance to confirm or clarify.
Right.
And then, of course, documenting the nursing diagnosis.
Mm-hmm.
That's a form of written communication
Yes.
that's essential for the whole team.
Gotcha. So if there's a breakdown in communication in that assessment phase,
Oh, yeah.
that can really throw off that nursing
Yeah,
diagnosis.
Absolutely. If you don't ask the right questions,
Right.
or if you don't really listen to the patient's answers,
Mm-hmm.
you might miss crucial information.
Okay.
For example, a patient might mention anxiety.
Yeah.
But if you don't explore that further, you might not recognize
Right.
how much it's affecting their overall health.
Right.
And you might not include it in your diagnosis.
You missed that key piece.
Exactly.
Okay, what about planning?
So planning involves working with the patient, their family, and the rest of the healthcare team.
Okay.
So develop a plan of care.
Right.
This requires clear communication,
Yeah.
discussing goals, interventions, expected outcomes.
Uh-huh.
You'll be explaining things, answering questions,
Right.
and of course documenting that plan of care clearly.
Okay.
So everyone's on the same page.
So why is that clear communication so essential in the planning phase?
Well, the care plan needs to be something the patient understands and agrees with.
Yeah,
If you can't explain it clearly, they're less likely to follow it.
for sure.
Effective communication ensures that everyone's working together,
Right.
which leads to better outcomes.
That's the goal.
It is.
Okay. Implementation. Now we're putting the plan into action.
Right.
How does communication fit in here?
Oh, implementation is filled with communication.
Okay.
You'll be providing education to the patient and their family,
Right.
using therapeutic communication techniques
Uh-huh.
to provide support, address their concerns,
Yeah.
help them cope. You'll be delegating tasks
Okay.
to other team members.
Right.
And of course, documenting everything.
Gotcha. So can you give me an example of like therapeutic communication during implementation?
Sure.
Let's say a patient is feeling really overwhelmed
Okay.
after getting a new diagnosis.
Yeah, so in that situation, the nurse might sit with the patient,
Uh-huh.
make eye contact,
Okay.
really listen as they express their fears and anxieties.
Right.
They might offer empathy by saying something like,
Yeah.
"It feels like you're going through a lot right now."
Right.
And then provide information in a calm and understandable way.
Mm-hmm.
Maybe help the patient identify coping strategies and support systems.
Okay, so it's about providing support
It is.
on multiple levels.
Exactly.
Okay, finally, evaluation.
Okay.
How do we use communication in the evaluation phase?
So evaluation is all about figuring out
Okay.
if the interventions are working.
Uh-huh.
Are they helping the patient reach their goals?
Right.
So you need to get feedback from the patient.
Okay.
Ask them how they're feeling.
Yeah.
If their symptoms have improved,
Right.
if they're happy with their care,
Okay.
you're also observing their nonverbal cues
Mm-hmm.
and comparing their current status to the expected outcomes.
Yeah, okay.
And if the plan needs to be adjusted,
Yeah.
you need to communicate those changes to everyone involved.
Right. So clear communication helps you determine if the care has been successful.
Absolutely.
By getting that honest feedback.
Yeah, and by observing them.
Okay, so communication is not just a nice to have. It's really fundamental
It is.
to every part of nursing.
Yes.
Now let's shift gears and talk about the therapeutic nurse-client-family relationship.
Okay.
Your notes talk about characteristics and phases of this relationship.
Right?
Can you walk us through those?
Sure. So the therapeutic relationship develops in phases.
Okay.
First, we have the per-interaction phase.
Per-interaction. So this is before you even meet the patient.
Exactly. It's all about preparation.
Okay.
You'll be reviewing their chart, talking to other caregivers,
Yeah.
anticipating their need, and planning for that first interaction.
So what kind of info should a nurse be gathering in this pre-interaction phase?
You want to look at their medical history, understand their current health problems,
Okay.
any medications they're taking,
Uh-huh.
any previous nursing interventions
Yeah.
that were helpful or not helpful.
Right.
Knowing a little bit about their social history can also be beneficial,
Okay.
like their family situation, their support system.
Right. So you can really start to think about
Yes,
a plan that's tailored to them.
exactly.
Okay, so then you actually meet the patient, and that's the orientation phase.
Right.
What happens there?
The orientation phase is all about building rapport.
Okay.
You're introducing yourself, explaining your role,
Uh-huh.
establishing a warm, empathetic tone.
Right.
And, the patient might be a little guarded
Yeah.
at this point.
Testing the waters.
Exactly. They might be testing your confidence.
Uh-huh.
You'll be observing them. They'll be observing you.
Right.
You'll start to assess their health status,
Okay.
identify their main concerns,
Uh-huh.
and start working with them to prioritize their needs.
Gotcha. You're also clarifying roles and responsibilities.
Yes,
And you're starting to talk about the end of the relationship.
exactly.
So it's not a shock later.
It's important to be upfront about that.
So what are the main goals for the nurse in that initial orientation?
Okay, so the main goals are to establish trust
Okay.
and a sense of safety,
Right.
clearly define the boundaries
Yeah.
of the relationship,
Mm-hmm.
and start to understand the patient's situation.
Gotcha. Their concerns, what they're hoping to achieve.
Exactly.
Okay, so you laying that foundation of trust.
Yes.
What's next?
Next, we move into the working phase.
Okay, working phase.
This is where the real work happens.
Uh-huh.
You're working together to address their health needs.
Right.
You're encouraging them to express their feelings,
Okay.
explore their thoughts and emotions about their illness.
Uh-huh.
You're providing information, setting goals.
Right.
And, you might use things like therapeutic communication techniques,
Okay.
appropriate self-disclosure, even gentle confrontation
Mm.
to help them gain insight and move forward.
So can you give me an example of a nursing action that would happen in the working phase?
Absolutely. So let's say a patient is recovering from surgery
Okay.
and they're really hesitant to start moving,
Uh-huh.
even though it's important for their recovery.
Right.
In this phase, the nurse would encourage them to talk about their fears,
Yeah.
where they're afraid of pain or falling.
Okay.
The nurse would educate them about the benefits of moving early
Uh-huh.
and work with them to set small, achievable goals
Right.
for increasing their activity.
Okay.
They might use therapeutic touch if the patient is okay with that.
Yeah.
Or maybe guided imagery
Okay.
to help them feel more comfortable and confident.
Gotcha. So it's about really supporting them
It is.
in reaching their goals.
Absolutely.
Okay. And finally, the termination phase.
Right.
This sounds like it could be tough.
It can be. It can be emotional for both the patient and the nurse.
Yeah.
This is when the relationship is coming to an end.
Okay.
Maybe the patient's being discharged,
Right.
or maybe there's a change in the care team.
Okay.
It's important to remind the patient that this is going to happen.
Uh-huh.
Give them time to process it.
Yeah.
You'll review their progress,
Okay.
talk about the things you've accomplished together,
Uh-huh.
and help them become more independent in managing their own care.
Right.
Ensuring a smooth transition to any follow-up care is also really important.
Okay, so how can a nurse make sure this termination phase is positive?
Well, being open and honest about the ending of the relationship is key.
Okay.
Acknowledge any feelings the patient might have.
Right.
Summarize